This is Dr. Harsh. I'm a consulting diabetologist practicing at Diab Connect Center that's in Opera House, South Mumbai. And I sit at multiple places at Kulaba, at Prabhadevi, as well as at Vile Parle. That's the Sujay Hospital where I'm having my MPD in the evening. And my years of experience is 12 years, and my topic of interest is diabetes mellitus and its complications, which includes the hypertension, weight-related issues, dyslipidemia, hypothyroid, as well as the gestational diabetes part. Yeah. So today's topic, I think, so in which I'm supposed to be talking about is going to be hypertension. So as you all know, that hypertension has been a very important morbidity which has been found to be present in a lot of population around. So we all know that blood pressure is something live in terms is a very important aspect that we need to take care of. And the right treatment is something which is very important for it in order to prevent complications related to it in terms of stroke or in terms of cardiac issues as well. So blood pressure is a very important part that we need to take it into consideration while treating our patients, because it is something which, if not treated, can lead to multiple complications that can be resulting into morbidities like a stroke or maybe a cardiac issue as well. So we all know that what is actually the blood pressure? It is basically when the heart beats, it pushes the blood into the blood vessels into our entire body, and it is being pushed with a pressure inside it, which is known as the pressure in the blood vessels, which is the basically the blood arc, and it helps in circulating the blood into the entire body. It goes into the arteries, and from there it goes to the peripheral part. From there it comes back into the body. So it is a pressure which has to be maintained into our body in order to have a good supply of blood throughout the body and its essential organs, and that is where the hypertension comes into it. So hypertension is not something which develops in a day or two. It takes over a period of time, and usually what happens is it happens because of more of arterial stiffness part. Unhealthy lifestyle is something which is a major contributor to it. Apart from that, if there is any other comorbidities, so if a patient is having any renal issues or liver issues or cardiac issues, it is basically precipitated in the terms of having higher blood pressure. In the lifestyle part, the most important part is a good physical activity, something which is required. Obesity, smoking, all these are major contributors in developing of hypertension. If we go to see the understanding the risk factors, so we have a multiple scoring system in understanding what exactly causes the blood pressure or the hypertension to be there in the body. First of all, as the age goes on increasing, the arterial stiffness goes on increasing. That is something which results into the blood pressure to go on a higher side. Family history plays a very important role. The genetic part do play a huge role in that. Also, the diet part of food with higher number of salt. Maybe you can talk about all the pickles and the things which are associated with that, that can cause the pressure to go on a higher side. Patients having kidney issues, also at a higher stage of having hypertension. Consuming processed foods, this is something which is very important, and that has been seen into a lot of our young generation, which results into blood pressure spiking up because of the preservatives, and also the body fat content goes on a higher side. All these things plays a very important role in development of obesity, ultimately leading into the blood pressure going on a higher side. Apart from that, stress also do have a very important role to play, and that is something that we need to understand. Usually that is something that we neglected, but over a period of time we need to understand that stress do have a major role to play, and we need to increase our lifestyle changes in terms of doing yoga, meditation in certain ways, so that we can have a better outcome in terms of controlling the blood pressure. Regarding the blood pressure, you don't see that every time the patient usually presents with a high blood pressure with a headache or something. There may be many patients which can find the blood pressure going on a higher side on an accidental finding, and that is something which we usually called as a silent code or a silent color, with which the patient might be having multiple issues or diseases ranging from heart problems to kidney failure, stroke, as well as hypertensive retinopathy, that is the eye issues as well, and also the death. And that is one thing why we need to diagnose it at an early stage and give a proper medication so that the blood pressure can be controlled. and all the symptoms can be controlled to a much lesser side effects. Regarding the symptoms part, you might have headache, you might have fatigue. There may be issues in terms of the change in the vision if there is any retinal issues which develop up. There is a buzz in the ears, tingling, numbness which might be there. Then maybe the patient will be having a vertigo issue. So all these things are a marker which the physicians have to catch up in order to diagnose the hypertension and then appropriately treat them. So in the blood pressure part, we have two parts. We have the systolic as well as the diastolic part. So we need to understand which is the one which we need to target. Normally, the blood pressure that we usually say for most of our patients is 120 milligrams by 80 milligrams of mercury. And if it is found to be more than that, we need to have a close monitoring to be done. Larger number of the systolic blood pressure, which is the upper part which I'm talking about, is because of the heart contracts, while the smaller number, that is the diastolic pressure, is happens up when the pressure is exerted by the heart between the two beats. So this is the two parts that we need to understand when we consider it to be a hypertension, when the blood pressure is in the range of 140 by 90. So this is the point where we consider this to be a hypertension. While celebrating World Hypertension Day, a day which has been marked by high blood pressure all around the world. So we need to check the pressure, keep it under control, and something that we need to have a good quality of life, which is very important. Regarding the prevention of part, how can we decrease or how can we control our blood pressure apart from taking medication is a regular exercise, a good diet. Drinking alcohol and cigarettes is something that is something which is very important and which we need to quit if we are taking it. Regular blood pressure monitoring, a stress management in terms of meditation or yoga, and medication as prescribed by the physician in order to have a better quality of life. In terms of exercise, a 20 minutes of walk is something which is more than sufficient if the patient is having a good lifestyle. But we have to calibrate it. We need to individualize. We cannot generalize the treatment for every patient of us. So a good healthy life, which the patient feels that they are having a good walk in spite of not having any breathlessness. I think so that should be a major marker which we need to understand. Regarding in terms of diet, so we want to use diet which can help in lowering the blood pressure or prevent the hypertension during that part. So we have the DASH diet, we have the Mediterranean diet, we have plenty of preservative food that we need to decrease it out, no alcohol, reducing intake of saturated and fat eating part is something that we need to keep in mind. So what does DASH mean? So DASH means what to eat and what not to eat in the patients with hypertension. So diet usually including the grains, the fruits, the vegetables are something that is usually promoted in such kind of a patients. And consuming fat and cholesterol food is something that we need to decrease it, and that helps in decreasing the blood pressure as well. Less intake of salt is very important. So we need to decrease down the salt food in terms of salt, the preservative food, the ready-made foods that we need to avoid. Uh, we don't need to add more salt. So a salt of small teaspoon contains 2300 milligrams of sodium. So we need to avoid that as well. Quitting alcohol, quitting smoking is something which is very important. And we need to have a constant regular checking of blood pressure, a very important aspect which most of the people don't take it seriously. We need to keep checking our blood pressure. If the pressure is found to be in the range of more than 140 by 90, we need to rigorously have a look at it and go to our physician in understanding what is the root cause of it and try to have a lifestyle modification and treat it accordingly. But the direction has to be provided by a physician rather than using our own knowledge about it, because that can be disastrous in having side effects or mortality as well. So that is something which is very important. Keeping the blood pressure normal is something which is very important for the patients with heart disease as well. And it is very much possible that we can keep the things normal by normalizing the blood pressure regularly and taking all the preventive measures along with the medications as prescribed by the physician. Thank you so much.